Welcome everyone. My name is Wojciech Madej, and it's really a big pleasure for me to be able to present you this interesting data where I would like to prove some new abilities of the medical device that we recently introduced to Brazil with the help of Ruta Medical. So if you allow me, I will share my screen now with the presentation. So I hope that's going to be an interesting half an hour up front, so we can have nice discussion that there are certain new tools that will help us to fight osteoarthritis and the symptoms related to this quite severe disease. Virna, could you just please confirm that you see the screen that I shared?
Yeah, we can see it.
Okay. So I'll take the advantage of another half an hour in order to show the data of a clinical study that we performed in Poland for the last 2 years, where we try to prove that the autologous, the blood-derived product, which we managed to make it rich with the DKK-1 protein, which is the Wnt pathway inhibitor, is clinically effective in patients with osteoarthritis. Of course, before I move to the subject of my study, I will just start with a short introduction. First of all, if we think about osteoarthritis, we need to realize that we deal with a very severe disease. First of all, osteoarthritis is a disease that is chronic and it is progressive. It means that currently, if the patient will start the journey towards the development of osteoarthritis, there's hardly any tool that will be able to stop this progression, and that will lead to the fact that those patients will end up at the operation table and they will require the total knee replacement. That's because all of that building changes, the pathological changes that build up in the joint of the osteoarthritis patients, they lead to the serious disability. The fact is that because of the aging populations in the countries around the world, and the fact that older and older people, they want to stay active, we have the effect that the number of the patients is still rising. So we have more and more patients that require the treatment and that will require the pain reduction and the improvement in the function of their joints. However, scientific knowledge is not enough currently, and it's not, let's say, that advanced in order to bring the effective cure. So there's no effective cure available on the market that will be able to stop the progression of the disease. And we can, of course, ask the question, why is that? I mean, what's the reason behind the fact that there's no cure? The fact is that when we talk about osteoarthritis and we talk about this disease, we really like to simplify a very complicated things, because there's not a single cause that has been identified yet in order to say, like, this is a single particular factor that will actually lead to the development of the disease. So we can talk about many different risk factors, and that means that we're going to have a really high heterogeneity of the patients. So if we see that those risk factors can be identified differently in different patients, because if we talk about, let's say, a 30-year-old athlete that has a joint trauma and that will develop osteoarthritis, that's a completely different profile of the patient. And then if we talk about, let's say, a 60-year-old woman which is obese and is not moving their body at all. So we can talk about different risk factors like sex, joint overloads, age, obesity, trauma, and or instability. And those risk factors, they will actually influence the patients in a different way. And those risk factors, they will also influence and put a pressure on different tissues like cartilage, synovium, bone, or synovial fluid differently. That's why we're going to have also the activation or the inhibition of different signaling pathways in those tissues. And that leads to the fact that we're going to have a really high really big differences in the background of those patients. We're going to have a really high heterogeneity of OA patients. So if we want to find a real cause of the disease, we really need to go down the rabbit hole. So we really need to go and analyze what is actually happening with those tissues at a molecular level. So we need to answer the question, on what activity or what kind of disactivity is happening at the TGF-beta, Wnt signaling, TNF, or maybe IL-1 beta. So we need to really ask the basic fact about the disease. And one of the candidates that the science and the literature shows that is actually has been proved to be involved in the development of the osteoarthritis is Wnt signaling pathway. The fact is that the Wnt signaling pathway is one of the most fundamental pathways in tissue development, and it controls many different physiological aspects of our joints, because it can control the metabolism of the cartilage, it can control the inflammation of the synovium, the bone remodeling, the osteoblast apoptosis, so the natural death of the bone cells, and also the differentiation of the MSC, so the stem cells. So from a lot of different aspects and literature data, it has been showed that Wnt signaling pathway is one of the major molecular triggers in OA. And we as a company also wanted to focus on that, and we wanted to see if we can actually find a way in order to control this signaling pathway. Because if we, of course, there's not enough time to discuss all of the really complicated details about this disease, but it is important to realize that Wnt signaling pathway works like every signaling pathway in our human body. So there is a ligand, a protein that is able to bind a certain dedicated receptor, and upon binding of this ligand to the receptor, we're going to have the activation of the genes. On the other hand, the same receptor has its own natural inhibitor. So the protein that is able to bind to the same receptor, but it is not able to induce the internal signaling. It means that if it's bind to the receptor, it completely blocks the ability of the natural ligand to bind to the natural receptor. So we're going to have the inhibition of the Wnt signaling pathway. And the literature shows that when we're going to have the activation of the Wnt signaling pathway, we're going to have the progression of the disease. On the other hand, from many different aspects, inhibits the Wnt signaling pathway, we are also able to suppress the progression of the disease. So it shows that DKK-1 is a very potent factor that is able to suppress the Wnt signaling pathway. And we use this advantage in order to find a kind of treatment that will be able to block the progression of the disease. Of course, that was first the theory. Luckily for us, because we analyzed a lot of different literature aspects, and we found that the platelets are very potent containers of the DKK-1. So the platelets in our blood, they contain a big amounts of DKK-1. So if we find a way, if we find any kind of a way in order to force the platelets to release the DKK-1, maybe we can find actually a solution for the delivery of high amount of DKK-1 to the OA affected joint. And of course, I performed for many years in our company, and we found that certain borosilicate beads that are able to attract a high amount of the electrostatic charge on the surface, they are able to activate the platelets to release high amount of DKK-1 into the solution. So we we introduced to the market a new generation of the medical device that contains the borosilicate beads. And these borosilicate beads are able to activate the PRI1. What is important to mention is that this is not a chemical activation of the platelets, because you can activate the platelets many different ways. You can also completely deassemble them, so they release all of the contents that they have. But that's not the point. You would like to have the selective activation, so you're going to have the release of the protein of your interest. So when we use the borosilicate beads and we concentrate the platelets, we are able to deliver the autologous blood-rich product that is rich in DKK-1. So of course, when we developed this device, that was only the theory. We wanted to check if this theory works, if you are able to first of all, deliver the DKK-1 rich injectable product, but also we have, of course, had to prove that it is clinically functional. In order to do that, of course, we designed a clinical study, which aimed was to assess the safety and efficacy of one single intra-endocrine of the autologous blood. We wanted to treat the primary clinical symptoms of pain and functional capacity in subjects with symptomatic knee OA. So the plan of the study was, of course, that was the first pilot study where we are already in the middle of the second study, which will be much bigger. But this pilot study involved 30 patients. Those patients were qualified at visit number 1, and those patients had single injection of blood-derived product rich in DKK-1, and those patients were monitored for 30, 60, 90, 180, and 360 days. So we monitored those patients for another year. Before we move to the clinical results of the clinical study by itself, of course, first we had to prove that we are able to concentrate the DKK-1 in our blood-derived product. So we proved that if you concentrate the platelets, so you are able to obtain the PRP, and because you manipulate the platelets, they will release a higher amount of DKK-1. So it is not significant, but you can already see that the platelets are able to release DKK-1. But we proved that when we use the borosilicate beads with electrostatic charge on their surface, we were able to significantly induce the high release of DKK-1 from the platelets. And that is significant, of course, very significant to the plasma sample. So we see that it's more than almost 6 times higher concentration of DKK-1 when you compare the plasma sample. And it's also significantly higher than the PRP. So we were happy with that. We saw, okay, we're able to obtain the product that will have the higher amount of DKK-1. But is it really functional? That was the question, of course, we wanted to answer in our clinical study. And of course, you can, let's say, the tools that you have in order to judge if your injectable is clinically functional in OA patients focus on 2 major aspects. First of all, you wanted to decrease the amount of pain that those patients subject, of course. So you can do that with a visual analog scale. So the patients can judge their pain in a scale of 1 to 10. And what we saw is that the patient had a very significant reduction of the pain from starting at 1 month after the injection, and that continuing to be present for the 180 days. And that was significant reduction, of course. We also see that those patients, they had significant. Of course, we can also measure, and that was very important to measure, the functional improvement with the WOMAC scale. And we see that when it comes to the WOMAC total score, we see a very significant improvement in functional of those patients. So the patients were highly improving from the therapy from the one single injection starting at 1 month after the injection, and that continued to be a very significant improvement for 1 year. So we were very happy with the results, because we had in the back of our head that if you want to use any kind of blood-derived product to treat your patients, you need to treat them regularly, at least for 2-3 times in a row, in order to achieve a very significant reduction and improvement of the function in those patients. But here, we actually talk about one single injection. That also confirmed stiffness score, so that was not significant, but we see that the effect is there. So when it comes to the conclusion, of course, that was only the first step of our investigation of this device. But we see that, at least for now, we see that it is very effective, because it provides a very sustained pain relief and sustained function improvement for up to 12 months after one single injection. So we don't need to follow the protocol that is normal, typical for a blood-derived product like PRP, where you need to induce 2-3 times in order to achieve a clinical improvement. In this case, you just need one single injection, and the therapy is safe by the definition, because it's fully autologous, and we also didn't notice any therapy-related adverse events or discomfort. So with that, I would like to thank you for this short ability to present this data. And so, as I said, we are following this idea. The idea is present to be available on the different markets. It is also available patients can be treated also in Brazil. It is of course certified as a medical device. So it is available in Europe, in different countries around the world. And we are also busy with a much bigger clinical study here in Poland, but also we are planning to open a bigger study also in the Netherlands. So that's a potential. Of course, if you are having any questions, I'm open for that. And if not, I'm also open for any kind of discussions via email. So if I don't know the answer, I'll for sure try to find it.